Joining us in the studios, first would like to welcome the Honorable Minister of Health, Professor Isaac Adewole. Professor Adewole, pleasure to have you again on Good Morning Nigeria.
My pleasure. Good morning.
All right, just before we bring in the other guests, let's start with you and to give us some more insights into what the Strategic National Health Plan is all about. And in particular, what distinguishes it from other policies or plans or arrangements that we have had in this country with regard to healthcare delivery?
Thank you so much. The National Strategic Development Plan 2 implies that it is not the first in the history of the country. It's actually the second one. We had one covering the period 2010 to 2015. But what is special about this is actually following the development of our national health policy. The National Health Policy 2016, which is the third in the history of this country, tries to situate itself within the context of the economic and growth recovery plan of this administration. And for the first time in the history of the country, we are linking health to socio-economic development. As we recognize, you cannot have a prosperous, socio-economically developed country without health. You need a healthy populace to grow the economy. And I think what has happened is that we're also looking at the fiscal system to fund this. And the Basic Healthcare Provision Fund is one of the mechanisms. When you look at it, we spent over 1 year, well, almost 2 years, developing the framework for implementing the Basic Healthcare Provision Fund. This fund is going to be located in Central Bank, and the first time in the history of this country, money will flow from Central Bank straight to the facility. There will be no lateral leakage of money. So when the money comes into Central Bank, it will move through the agencies straight to facility. And the facility will have a commercially operated bank account with two signatories, the head of the facility and the head of the political ward in that community. That's one. Secondly, we will have co-mingling of funds. Co-mingling of funds imply that if you are a donor, like World Bank,
Dr. Aminu Magashi Garba, who is the coordinator of Africa Health Budget Network. You've listened to the Honorable Minister as well as the Niger State Commissioner for Health. Give us your own impression of what this Strategic Health Development Plan is, Phase 2, as well as the provision fund that has been outlined to help finance the objectives and goals in the Development Strategic Plan.
Thank you so much, and let me begin to mention what the Minister has mentioned about the plan over the next 5 years will require 6 trillion naira to be implemented. That's more or less every year we need to mobilize 1 trillion naira to implement the plan, if the plan is going to be implemented. That is a huge tax. And of course, it's not only going to be the federal government. The 36 states and the FCT need to also mobilize money to meet up the 1 trillion naira annually to implement the plan. So, and also looking at the Basic Healthcare Provision Fund, it is not going to be adequate to support the plan too. We are talking about mobilizing 55 billion naira annually, from the Basic Healthcare Provision Fund. That we need to also mop up additional funding from the private sector, from the development partners, from the community to actually galvanize action. This is a huge tax, but as he has mentioned, we need to work together. What is the role of the civil society organizations and the media, where we actually belong? You heard from the report of one of your reporter, the Senate chair of the Health was mentioning that the civil society, they need to be engaged. So also the media, because having all this funding available, the community, the people need to understand this information. When we talk about transparency definition in a simple way, it means that the information is not only available, but people understand and act on the information. So with all these commitments from the federal government and all the states, we need to ensure that the civil society organizations are fully on ground. Not only at federal level, because I think we are doing so well in engaging the CSOs at federal level, but the gaps we're having is at the state level, where the civil society, many of them are not even aware of all this good initiative. You are aware that on Tuesday, state governments receive a lot of funding. One state government collected about 28 million US dollar to support the primary health care and so many programs. Some states collected $8 million, $6 million, $7 million. Those are huge money. We need to track that money. We need to know where that money is going to. We need to know how will the state government implement this budget. I was already jokingly also discussing with my friend, the commissioner, that we need to have scorecards of all these resources, where they are going and how they are going. And also we need to inform the society at the state level that you have funded, engage the ministry to ensure that this money is utilized properly.
All right, Dr. Magashi Garba, thank you very much. Let's press
of the basic care provision fund. 45% of this money will go through primary care development agency. 20% for commodities. The facilities on their own will be able to determine what do they really need. Paracetamol, cotton wool, methylated spirit, simple things. For the first time, 15% of this money will be to maintain the structure. We want to change pipes, we want to make sure that the bulbs are replaced. So if you enter into it, and we now have diagrams, you feel sorry for Nigerians when you look at some of those photographs. PAC with no beds, broken down beds, but we are going to fix this. Once it is fixed, the photographs are also there. And we have a quality improvement. We have scores for each facility. And we will be scoring them every 3 months. So things are laid out properly. But let us also take into consideration the fact that we will need to be truly motivated. We will need to work with civil society organizations. We can't do it alone. That's why they're there. We want the media. We want Nigerians to challenge us. We want them to visit those facilities and complain. And I can assure you things will be done differently.
Let's have your reaction to the likely implementation challenges with regard to phase 2 of the Strategic Health Development Plan.
So, thank you. I would like to summarize that with the issue of the greater accountability and transparency in delivering the services. And let me go down to the community level where the Honorable Minister mentioned about the facilities getting money directly from the agencies to implement the activity. That is an additional burden. You know, when you give a medical officer in charge of a primary center, apart from doing the work to deliver for the patient, now also managing resources bigger than what that person is used to, and also bringing the community heads to also sign the checks. That is also additional burden that we need to be aware of. We need to ensure that the facility, they have the capacity to manage their resources. Otherwise, we'll have plenty of money in the hands of people, and at the end of the day, we're not going to see any services. So we need to demand for that greater accountability, not only for the facility, but all the state agencies that are going to provide oversight. The State Primary Health Care Agency, the State Insurance Scheme, we need to ensure that that capacity is there. We shouldn't assume that they are fully prepared. The structure could be there, but do we have the human resources that will ensure proper monitoring and evaluation of all those services? So I want to wrap up with saying that the greater accountability is very key. Monitoring, reviewing, and taking remedial action for any activity that we are doing at the state level should be the cornerstone of the Plan 2 and the Basic Healthcare Provision Fund. Thank you.